Hello and welcome to the On the Couch podcast, the podcast that gives you the view from the therapist's chair. I'm your host, John Dennis, a licensed professional counselor. You're listening to OTC episode 28 with Reina Lombardi of Florida Art Therapy Services. Welcome back once again, OTC listeners. Thank you, as always, for joining me on the podcast. I'm super excited today to be bringing this episode to you. This is a conversation about art therapy and just the amazing benefit that art can be as an expressive therapeutic tool. And I get to talk with Reina Lombardi about, what is art therapy, what it is not, who would benefit from it. And when you really step back and look at it, anyone can benefit from art therapy. It's not something that is just for children. It promotes relaxation, communication, emotional expression. It can be so beneficial as a therapeutic tool. And there are so many studies out there that show just the amazing benefits of art therapy, that it can really impact those struggling with a number of issues, including depression, anxiety, PTSD. But again, beyond that, it can help with so many different things. I absolutely loved this conversation with Reina because she's so down to earth and was super generous with her time. It was great to be able to catch up with her and put this episode together. And so on my end, art has always been part of my background. I actually almost went to school for art and late in my high school career switched to psychology. And they'd kind of always been neck and neck in terms of passions, but it's always been something that I've had a hand in and have always known just the benefits of art, whether that's through photography or painting, drawing, just so many different mediums out there for expressive art therapy. In terms of Reina Lombardi, she is the owner and founder of Florida Art Therapy Services there in Fort Myers, Florida. If you just go to floridaarttherapyservices.com, you can find her website. She is a registered and board-certified art therapist and art therapy certified supervisor. There's a mouthful. And she is a licensed mental health counselor in the state of Florida, as well as licensed mental health counselor qualified supervisor. Yet another mouthful. She's a member of the American Art Therapy Association for Play Therapy. She was formerly the treasurer for the Florida Art Therapy Association. She's contributed chapters on art therapy to the text Integrating Expressive Arts and Play Therapy, a guidebook for mental health practitioners and educationers, as well as a chapter on art therapy supervision to the text Digital Art Therapy, Materials, Methods, and Applications. So bottom line, she's very knowledgeable, super involved in the world of art therapy and supervision and giving back to the counseling profession. So I hope that you all get something from this episode. Well, on the couch listeners, I'm so excited to have Reina Lombardi, owner and founder of Florida Art Therapy Services, on the podcast today. So, Reina, welcome.
Thank you for having me, John.
Oh, thanks so much for being able to put the time together to meet with me. So, thank you. So, jumping right in, tell me what do you do? Yeah, what is Florida Art Therapy Services? What's your role?
Yeah, so Florida Art Therapy Services is a small private practice, and we're located in the Fort Myers area. And it's myself and then 5 other therapists, and we provide individual therapy, group therapy, family-related services for the community. And then we also do contracted work providing art therapy groups specifically within other agencies in the community. So we do a lot of collaboration with a variety of different agencies in the community, from elderly services to substance abuse treatment programs, and then other work with children on the crisis unit at one of the local community mental health hospitals. So variety of places we're out. And then at the office too, besides that, we do training. So we do other continuing education training. The practice is a continuing education provider for the state of Florida Board of Licensed Clinical Social Work, Marriage and Family Therapy, and Mental Health Counseling. So we provide continuing education programming as well.
Yeah, you're busy. Okay. And yeah, obviously, I definitely want to get into those different programs, but just to start the ball rolling, what is art therapy? I think so often it conjures up different ideas for people, but yeah, if you can just kind of unpack that.
Yeah, it's kind of big to unpack.
Yeah, how long do you have?
So, generally speaking, the easiest way to describe it would be kind of a hybrid discipline between mental health counseling related theories and applications, and then artistic development and education, and they kind of marry and blend. And so art therapists are required to have foundational studies in both psychology and art. So everybody's required to have foundational courses in art, so that if you're working with a client who's unfamiliar with how to use materials, you're able to provide them with the support and guidance that they might need to be successful in communicating what they want to communicate with the art. But we're also knowledgeable in theories of human development, and that certainly plays a large role in how we use the materials with clients. Art therapists, in order to practice, are required to have a master's degree. And so for me, I decided to choose a program that offered the ability to obtain the master's degree in art therapy, and then also take additional courses so that I could become licensed as a mental health counselor. And there are a variety of master's programs that do that. Some do and some don't. But that was the course that I decided would be most advantageous for me.
And that's interesting. It almost sounds like, like dual degree, because you get, like you were saying, you've got to have the clinical background knowledge, but also the art background knowledge as well. Okay. Man.
Yeah. And so how one art therapist might practice is going to differ based on what type of psychological theory they're integrating into how they're applying the practice. So, for example, you might find some art therapists that are really grounded in mindfulness and positive psychology. And so their approach is really going to be interweaving those concepts and how they engage their clients with the art materials. For somebody who, say, is working with a population that, say, are younger or individuals with developmental disabilities, they're going to be taking a more developmental approach, and their end goals for the way they're applying those services are going to be different. So it looks different depending upon the therapist who's practicing and depending upon what population you're working with, and then what are the goals for the clients that you're serving. So it can be really adaptable.
And I'd like to pause there for a second. So somebody in the public, somebody that's uneducated about art therapy and therapy in general, how would they determine that? I guess what questions would they ask the art therapist about their treatment modality or theory or yeah.
So, I think some people say, well, I don't know what art therapy is, but I really enjoy expressing myself with art. And so they might self-select to come to art therapy services. Or, for example, we work with a lot of teens in the practice. And parents might say, well, my teen is really gifted in expressing themselves using art, and that seems to be their preferred method of communication. And we think that this might be helpful for them. And then it would really be the therapist that engages the client and the family in an assessment, just like you would in any other therapeutic intake session. We would go through an assessment and gather all the biopsychosocial history and really look at what's going on for the client. And then we would collaborate together to say, okay, here's what we want to address. Here are the outcomes that we'd like to experience. And then the art therapist would tailor the interventions that they're using to help achieve those outcomes.
Okay.
If that makes sense.
Sure. And that's starting to lead us into I don't even know what art therapy is. What do you find are misconceptions a lot of people have or myths surrounding art therapy?
Oh, gosh. Yeah. So,
so many.
there are a lot of myths out there. One myth would be that anybody can do art therapy or that anybody can call the work that they're doing art therapy. But really, in order for it to be art therapy, it would have to be the art and the therapeutic process would have to be done with an art therapist. The art therapist is likely going to engage in inquiring different kinds of questions, having the client describe the artwork in different ways, talk about the artwork in different ways. Mm-hmm. They might ask the client to give voice to the artwork from either a specific character or figure that's rendered in the art, or perhaps a different color. They might ask them to give voice to that and allow them to go a little deeper into understanding what the artwork means for them, which is really where things start to happen and the magic starts to happen, because when we do that, it allows the client to move from a place of unconscious to conscious, and we start to bring to light things that maybe have been hidden by our own psychological defenses and resistance. And so art therapy really has to be done with somebody who's trained and understands the limitations of the materials, what could happen if you utilize certain materials, certain loose or fluid materials with individuals who are in a regress state or in a pre-psychotic state. Those loose materials might trigger them to have a break, which would be unhelpful. And so, it's really important, I think, to educate the public, and so that they do understand that art therapy is more than just the process of creating a piece of artwork. There's a lot more that goes into facilitating somebody through a therapeutic process with art materials.
Sure. And I'm so glad you brought that up because, I think for a lot of people, different myths that I've encountered of like, I think of, it's this sort of just hippy dippy, Professor Trelawney, Harry Potter kind of like you're just, splattering paint on things and like, finger painting all over the place. And like, how is that actual therapy? So for you to cover, like you've got to have the clinical background in case that person does have a break or a trigger, and being able to help them through that, in addition to being able to help them express themselves with the art and communicate that. Wow.
For sure. And when you think about working with individuals that, say, have experienced trauma, and a lot of art making engages the senses, particularly if you're using wet media or if you're using some kind of modeling material, that can be triggering and really open somebody up and have a negative reaction. And so it's really important that the person is understanding of that and knows how to help guide the individual back into a grounded space if that were to occur. Hopefully, it wouldn't. They would have the knowledge to, prevent that from occurring in the first place. A lot of therapists, art therapists, use something called the expressive therapies continuum, which is a theory that kind of grounds and helps you to determine what type of media to be using with what type of client, and moving from a place of really rigid materials to a place of loose materials, or moving from a place of loose materials to more rigid, depending upon the person that you're working with and where you are in that therapeutic relationship. That would help you determine what kind of medium you're going to use. So, for example, individuals that tend to be very perfectionistic, they're going to self-select to use really rigid materials. They're probably going to want to use pencil and eraser, right? So they can erase their mistakes over and over again, and you can see that. And so your work with them is going to be to gently move them to a place where they're able to tolerate more loose materials, and to be able to be more flexible with uncontrolled experiences. And so you might use the art in that way as well. And so there is a little hippy dippy there in that regard, but it's all goes back and is grounded in theory.
Sure. Well, and I'm so glad you brought that up as well, because that one of the questions of that continuum, and how do you determine, that was going to be one of the listener questions I was going to ask, is somebody had written in and asked, do you know, are there certain issues or certain diagnoses that don't lend themselves well to art therapy, and then are there other ones that do?
Oh yeah, that's an interesting question. I feel like art therapy can be beneficial for all people. I think one of the ways that we know we're human beings is that we create, and art, if we break it down to its most basic form, is creating. And we're all born to create. It's one of the things that make us human. And so it can work really with any population. I think where it comes up of like, this doesn't work for me, or when people are resistant to it. So there has to be a sense of opening. But even with resistance, it's possible to engage clients that one would think wouldn't want to engage in art therapy. So, for example, going back to the myth question, sometimes people think it's only for kids, or it's not for adults. And that's not the case at all. There are many adults that engage in art therapy and find it helpful. I think in working with the substance abuse population for a number of years now, Oftentimes I encounter, especially adult males, that are very resistant to this idea of using art materials to express themselves. And sometimes there's also kind of this thing you have to overcome, which is individuals stop creating art probably around middle school age, when if you look at artistic development and the theory of Lowenfeld's theory of artistic development, that's when we start to really focus on photorealism. And not everybody is able to master that skill. It's a difficult skill. And that becomes a time where people start to really withdraw from the free creative process. Okay. Whereas if you look at young children, they don't censor themselves at all. They're like all over the place and they're like, look at this. And you're like, tell me about what that is, because I can't determine, mm-hmm. But they know what it is. And then we get to this place in middle school age, early adolescence, where the focus is on that realistic, and then people kind of stop there. So when they're
self-select out.
Yeah. And then when you're presenting it to them 30 years later, they're like, oh, I don't know about that. I can't draw. I can't paint. I can't do this.
I usually reference similar, more on the self-confidence end of things, and the willingness to try and fail and things like that. If you ask a kindergarten class, show of hands, who in here is an artist, like every hand goes up. If you follow that same class and you ask them senior year in high school, like maybe one or two hands go up, and they usually like look around to see, who else is
right.
This cool? Is it okay if I do this? It's usually not the confident, like hands shot straight up. So yeah, kind of in line with what you were saying about the development.
Yeah. And so then that, really comes into that question of who is this not for? Who doesn't this benefit? Well, I think it benefits everybody, but it's up to the therapist to facilitate and support and encourage and help people to move through that resistance over engaging in the artistic process and allowing them to go there. I know many people tell me after participating in groups in the substance abuse community, I came today, I didn't know what to expect. I didn't think I was going to get anything out of it. I thought it would just be, like arts and crafts, but this was a really deep experience. I got more out of it than what I was expecting, because it has the ability to pull stuff up and then you can see it in a tangible way, mm-hmm. where you can't if you're just talking about your life experience.
Well, and yeah, there's even techniques of, working with your non-dominant hand or, things like that really tap into other parts of brain and other parts of memory and
right.
things like that. It's just so yeah, you kind of started us down that path of when I heard working with substance abuse treatment, I'll be honest, for me a lot of times it's arts and crafts, it's macaroni necklaces and watercolor and but how do you use it in treating substance abuse?
Yeah, and I think in some places that is people's experience, and that's what they've experienced. Again,
sort of partial hospitalization program where you just come for a bit, you work with a little, you draw or color or things like that.
Right. Which, the coloring, that's wonderful. It can be very grounding and centering for people, but it doesn't necessarily constitute being art therapy. But I think people are exposed to those kinds of arts and craftsy type things in different hospital settings under the guise of it being art therapy. But because of the myths around what art therapy is, it often gets perpetuated, right? Because, well, that's what I thought it was. That's what I was told it was. And not supposed to know any different. So sometimes people come to groups and they've been in treatment before, and that was what they were exposed to. And I choose to work from a more insight-oriented approach in working with substance abuse because I want to make them feel very uncomfortable. So
even more uncomfortable than treating substance abuse. Let's just ratchet it up even. Yeah. Well, and I say that because, I mean, usually most people do not want to go to substance abuse treatment. Like most people are forced against their will, and there's a bit of a thick outer shell you got to get through there. So it's interesting to hear you say like you want to make them uncomfortable. Okay.
Yeah, we want to help them learn to become comfortable feeling uncomfortable because their habituated response has always been to avoid, use, numb out, whatever, once those feelings of discomfort arise within, whatever that means for that individual. So I always have a directive that's not always, but the majority of the time, it's very insight oriented. Oftentimes I'll integrate a lot of CBT type work with them because I want them to think about the role of their thoughts and how their thoughts influence their choices and their emotional reactions, and then integrate some different DBT type skills within the art making directives as well.
And just to unpack for any listeners, so what you're referencing with the CBT of cognitive behavioral therapy and the DBT being the dialectical behavioral therapy.
Yeah.
So and are you able to share just a little bit of like how are you making them uncomfortable?
Well, so usually the directives that I give are going to be having them think about things that they would typically avoid. And then they're going to be making art about that stuff, whatever it happens to be. So, for example, it might be underlying messages that they learned in their family of origin about how to cope with feelings. So that might be the topic that we introduce, we talk about, and then we go into a directive where I ask them to create a piece of art, and they're free to choose whatever art materials feel comfortable for them to use. So I do offer collage to try and kind of move over that barrier of entry. And that's usually really helpful. And people will start with the collage and then they'll add other things or, move to another medium afterwards. And so I'll ask them, to create an image that relates to, what was the most powerful underlying message that they received growing up in their family of origin as it relates to coping with feelings. Because generally speaking, one of the primary problems is an inability to tolerate emotion and cope effectively with emotion. So that's going to be very uncomfortable for them.
Yeah, no, I could see that. Okay.
But in doing it, and we, I put out a lot of rules about how no one's expected to be a masterful artist. Nobody needs to have any artistic experience to benefit from this. Think of it as an opportunity to explore. This is just an opportunity to explore. We're not going to be selling their artwork or putting it in a museum or showing it or anything. It's for them to keep. And I encourage them all to keep their artwork throughout their process in treatment so that they can reflect upon it later on, particularly if they come to an art therapy group early on in their treatment in the first week, say, they're going to be in such a different place at, 32 days in or 42 days in, where then they can look back and see the tangible evidence of how far they've come and grown.
You're listening to OTC episode 28 with Reina Lombardi of Florida Art Therapy Services. We'll be right back after a brief word from our sponsor.
Would you like to talk to a counselor but can't find the time? Would you rather talk to someone from the comfort of your own home? If so, Parenting and Family Solutions is here to help. We now offer teletherapy to all clients who reside in the state of Pennsylvania. Using our secure portal, you can have a video session with your counselor using a laptop, desktop computer, or smartphone. Visit our website to learn more at www.parentfamilysolutions.com or give us a call at 717-602-5560 to see if teletherapy might be a good fit for you. Let us help you build a stronger family and a healthier you.
Jumping to the next question, how is it being used in treating children with crisis?
Sure. So I've been facilitating art therapy groups on the crisis stabilization unit for about 5 years. And, kids come in there for a variety of reasons. And I've seen kids as young as, 5 or 6, all the way up to 18. And so you don't get a homogenous group.
Okay, and so it is in a group setting. Okay.
Yeah, it's a small group. So I work whoever happens to be on the unit the day that I'm there, the days that I'm there.
Which I would imagine you probably run into at the substance abuse treatment as well. That it's
sure.
Some people are graduating, some people leave.
Right.
Okay.
Right. In the substance abuse, same thing. People are at a different point in their treatment. So it's not always homogenous either. In this case, though, with the kids, it's different because how you're going to present to work with an 8-year-old who is struggling because they have a lot of executive functioning skill deficits and can't sit still, can't regulate, doesn't know how to be appropriate with peers. At the same time with a 15 or 16-year-old who might be struggling with some early signs of substance abuse, and they're sitting at the same table and you're working with both of them at the same time.
Wow. Yeah, I can see where that would. And sorry to interrupt, but is it just you, or is it like you're facilitating and you have like a co-facilitator, or how do you do that?
No, it's just me. There are the behavioral health technicians on the unit that are present, and that will vary based on how many kids are on the unit at a given time. Lately, there's been a higher influx. When I first started doing groups, maybe when I would go, there would be, 3, 4 kids. And now we're seeing upwards of, on average, the past few months of school was like closer to 12 or 13 kids every time I would come.
Sad commentary in itself, but yeah.
Yeah. So I basically I don't try to push them to the same limits of uncomfortability as I do with the substance abuse group. So we do a lot of
safer
stuff
for you.
Yeah.
And everybody else. Yeah.
a lot of stuff that's like general, like coping skills, talking about what's going on in their family, like family dynamics, perhaps, interpersonal relationship skills, identity. We do a lot of artwork around personal identity because that is a time for that. And the majority of the time it is more of an, preteen adolescent population on the unit. But every once in a while, There's unfortunately younger kids there as well.
Yeah. Well, and not to trivialize what you do or minimize it, but I mean I imagine a lot of it is, unfortunately the Band-Aid for the gunshot wound type of analogy, where you're trying to expose them to sort of the beginnings of art therapy, and in the hopes of helping them stabilize, and then possibly they work with that or learn how to express themselves through that after they've left.
It's an opportunity for them to express themselves for sure. And most kids are interested. Every once in a while, there's some teens that are not. But most kids are, and it's an opportunity for them to express themselves, communicate what's going on for them. And then the team at the hospital is wonderful. And so the doctor the treating psychiatrist will have them bring their artwork into their meetings with her, and pulls out what's going on, so that the artwork that we're creating in the therapeutic setting is then also being used to inform their treatment across the board while they're in there and beyond.
Wow. So you got to share some success stories, because you're working with some pretty heartbreaking stuff. Please tell me you've got some success stories. What are some positives you've seen come out of the work?
Wow. It's difficult. Sometimes we don't see the success stories, especially when we're doing this kind of work where we're going in and
transient. Yeah.
And we're meeting with somebody maybe one time. But I think that's where it really comes down to stressing the value in that single opportunity. There's always opportunity for therapeutic growth and change in a single meeting. Sometimes I think when as therapists, we might get caught up in the idea of I need to work with somebody for a long time in order to really affect change and provide impact. And while, yes, there is value to that kind of work, and that is important work, there's also value and impact being made from a single therapeutic experience. And so for me, every time I do a group on the crisis unit, for example, we have a follow-up survey that the kids have to fill out about their experience. And one of the questions for me that was important is, are you open to receiving therapy? After having this experience, are you open to working with a counselor about what's going on for you? Because a lot of the kids that come into the crisis unit haven't had any experience in counseling before. So this might be their first interaction with mental health services. And so, I'm thinking I just want to prime the pump and get them open to receiving further services with somebody when they leave the hospital, right? I want to break down, again, thinking about that resistance is breaking down the resistance and opening them up. So I might just be planting a little seed, and hopefully, the person that they end up going to can water it and foster it and help them to grow. But for me, getting the responses on the survey where the kids say, yes, I'm open to working with a counselor. That's small but positive growth there, I think.
Well, and I would imagine you've got to have, I think of, sort of the American Idol, America's Got Talent, the videos that people put up on Facebook where, somebody steps on stage and you kind of judge them before they even open their mouth, and then they start singing, and it's whoa, you get kind of blown away by what they're doing. I would imagine you have some of that also, where some of the stuff that they're creating and expressing is just so powerful and so beautiful. So
absolutely, there's that too. for sure. I think, I feel like I've had success in those little tiny moments, and then also the success of, working with kids through their teen years because they've been self-harming and, just in a really, really low place, and seeing them transform and move to a place of insight into their life and a place where they're really taking action and become really invested in their own growth. That's an amazing thing to behold, I think, no matter what kind of modality you use in treatment.
Sure. Well, and I'm glad you brought that up. The kind of going back to that continuum of, okay, what mediums do you use, and depending on what the person's dealing with. I found in my outpatient practice a lot of self-injury, depression, bipolar disorder. A lot of people that struggle with those types of things oftentimes are very creative, are very expressive in art, and in the therapy end of things, you're aiming for replacement behaviors of like, okay, how do we put in some other things so you're not doing self-injury?
Right.
A lot of teens are very negatively expressive in their artwork or journaling or poetry or things like that. Is that a similar? Do you ever try to shift the artwork where it's like, okay, it seems like you're really stuck on expressing this over and over and almost in a self-injury type of way, and are you trying to introduce other ways for them to communicate? Or
Yeah, I think you bring up a really relevant and a really relevant point, and something that we do see frequently. And one word that you used really stuck out to me, which is stuck. They're stuck in this place. And so it's, how do we help them to get unstuck, right? How do we move them forward from that? And I would say I would not recommend saying, no, you can't express yourself in this way, because, that's not going to feel very good. Like that might bring up issues of shame. And sometimes that does come up in the parent work, right? And
that's
the
That's
parents.
where I was headed. You beat me to the punch.
Yeah, right. Because I understand the parents are scared. They see this and they're like, oh my gosh, I do not know what to do. Help me help my child. I'm freaked out. This scares me.
Well, and I think a lot of that also sensationalized in popular media of TV and movies of like, oh, if you've been sexually abused, you're going to draw really awful, horrible things, and then if a child is drawing some of those things, it's like, oh my gosh, what are they doing? I can't believe this. And yeah, I think I really like the way you said that of like they're stuck. But at the same time, if they're drawing it, if they're writing it, that's their way of getting unstuck. And if you stifle that, they will stay stuck. Is that
right?
a good way to put it?
Yeah, absolutely. And I think as you're working with them, you want to be guiding them to alternatives, right? You're going to be introducing them to alternatives. In how they create and how they express, and bringing a different focal point, right? If they're really focused on things being absolutely horrible and negative and dark, how do we help them move to allow just a little bit of light into what they're creating? Not a lot, just a little bit, right? Can we introduce one more color into your black and red piece? Just one more color.
I choose gray. And dark, dark gray.
Right. But we're moving to a shade lighter.
Yeah.
Right. And so I think the work that we do when people are in a really stuck place is often very, very subtle, and it can be painstaking and slow. Um, it's not always super quick. It's not brief and solution focused, unfortunately.
Oh, but we're Americans. That's what we demand is in 2 easy installments or, the quick pill.
Right, right.
Yeah.
Do this, everything will change.
Yeah. Yes, you'll be unstuck. And that kind of leads me way back in terms of the myths of, the psychoanalysis of, why are you using those colors and what colors are you using? I think a lot of people have that in their mindset that you're doing this like psychiatric, psychological assessment of the art that they're creating
Right.
to determine, do they need to be hospitalized or are they safe or, things like that.
And I think sometimes there can be some indicators. You see certain things happening, or you learn, but it's always a theory, right? Like if I see somebody and they're maybe every time I see them, their artwork is really heavily focused on eyes, right? There's just eyes everywhere. And along with the eyes, there's like, it's just this really frenetic kind of energy in the artwork. I'm really going to start to theorize like, I wonder if there's something else going on here. Might this person have some form of psychosis that they're struggling with? I really want to explore that further. I'm not going to say, looking at this is an absolute. Never.
Yeah.
It's always
deeply troubled, and
yeah, it's always going to be an exploration, because everybody's symbology, the symbols that people use and the icons that people use, that is going to have very different meaning based on the individual, where they come from, what their culture is. And, we can have the same image and have two very different experiences of what that means. And there is a lot of myths around diagnosis from from certain pictures, like the house tree person assessment, for example, comes to mind, where people say, oh, there's a knot in the tree. That must be an indicator of sexual abuse. And that is not necessarily true.
Yes. So, can you just briefly, one-line synopsis of house tree person?
Yeah, the house tree person was developed by a psychologist, I believe. Not an art therapist, but it's a common assessment used in our field for many, many years. And one of the things that people would do is like, draw this picture, and then I'm going to take it back and I'm going to analyze it away from the person who created it. Mm-hmm. And while the house tree... Yes, you're like analysis. Projecting. Yeah, you're projecting your own analysis based on your own understanding. And so you can't really understand an individual's artwork on what it means to them without including them in the conversation. They need to tell you. And if you go, I'm not sure about that, I'm just going to make a side notation of that. I'm going to keep my eye out for this because I'm a little concerned. They might not understand that that's what's going on for them, but I'm not going to say this is an absolute thing that's happening for them. But I'm going to note it like, I want to keep an eye and explore that and see if it comes up in any other of their imagery. And then you might say, I've been noticing a theme. Let's look at all these pieces that you've done and put them out together on the table. And do you notice that this particular image keeps showing up. What do you think that's about? What does that symbol mean to you? Where have you seen it before?
Well, and I almost think of, they talk about in parenting, when your child brings you a drawing, don't project onto it and say like, oh, that's a really nice, you're supposed to more ask, oh, what did you draw? What is this a picture of? So it's their perspective.
Yeah. You don't want to crush the
with
3-year-old.
Yes. And I mean, I don't even want to go down the rabbit hole of like all of like the repressed memory cases back in the 90s, 80s and 90s of, it's so easy to lead somebody when you project onto their artwork. But it's much more important. It kind of made me think of especially cultural differences of in some Hispanic cultures, the mal de ojo, the evil eye is something that they believe very, very strongly. Or so eyes might be a part of their drawings. Doesn't necessarily mean that they're, you have to get their interpretation, their understanding.
Right. What's their personal symbols, right? Everybody has a set of personal symbols, kind of like lucky numbers and things like that. There's a go-to image that we have, and it means something. It means something individual to each of us, or it might mean something as a cultural association. Same with colors. There's lots of color theory out there, but it's great to know about it. But it's also important to know what the color means to that individual and recognize that different colors are going to have different meanings based on what culture an individual comes from.
Now, here's one that made me think of was, okay, so if especially in the substance abuse treatment, if the person has tattoos, are you talking with them about, tell me about that. What's important to you about it? What's the story behind it of the body art?
That's really interesting. There's an art therapist. Her name's Simone Alter Murray, and she did a presentation about this particular topic with tattoos in art therapy. Somehow, I didn't get to attend it, but now that you're bringing it up, there is somebody who has been doing research and utilizing that. I don't necessarily. Sometimes people will show me their tattoos and talk to me about their tattoos, but I usually don't inquire unless they bring it up. Sometimes they'll draw in their artwork a tattoo that they do have on their body, and then they will talk about that meaning that it has for them and the importance that it holds for them.
Okay, cool. So if somebody were, I know like you had said that obviously the art therapist, the state licensure, it takes a lot to achieve that. On the public end of things, if somebody were artistic and wanted to do something for self-care or artistic expression, are there techniques like homework assignments that you give them to do on their own outside?
So sometimes in treatment, we'll definitely give homework and encourage them to do artwork. It just depends upon the individual. Again, I feel like there's not like a, easy linear answer.
There's no paint by numbers homework assignments you get?
No, it really would be tailored to what's going on for the individual and what we're working on, what we're doing. But I encourage people to do their own artwork and to use their own journaling process. I feel like there's so much that can come out of that. For me, something that I learned in graduate school and I still use personally when I'm doing my own self-supervision, and I encourage other therapists, which I supervise, or whom I supervise to do so as well is something called dialoguing with the image. So we might create a piece of art and then have a question and answer response with the image. And I'll write that down, and that will be kind of my journaling prompt. So I'll say something to the picture, and then I will have the picture say something back to me, and write it down, and then just see what comes out of this conversation. What does it have to tell me? What am I missing? How could I maybe be more empathic to what is going on for the individual, like especially if it's somebody where I'm struggling to relate to, if there's a lot of countertransference or something like that. That can be very helpful. And I'll ask clients to do this as well.
Okay. And sorry, can you give an example or two of some of the, I guess, questions, or that idea of dialoguing with the art?
Definitely. I can actually share with you. I have a handout, and it's dialoguing prompts, and so I can share that with you too. But it would be things like, what do you have to tell me that I don't know yet? It might be something along the lines of, what do you need from me that I haven't been giving you? Right? What are you afraid will happen if whatever it might be? So that might be an example if you're working with a client and they're, afraid of making change, right? What might happen if you use coping skills? Like what are you afraid will happen if you use coping skills? What are you afraid you'll lose? So it might be along those lines.
Man, I can see where that would be really powerful, really open up a lot. So thank you.
Yeah. So it could be a whole variety of things too. And it might even just be speaking from a place of I am. So thinking about more of kind of Gestalt therapy, where you have like the empty chair.
Yeah. That's what I was starting to think in my head as you were describing it. Sure.
Yeah. And so except instead of the empty chair, you're replacing it with this image, and then you allow the image to speak from an I am place and describe itself to you. And so working from that prompt too.
Well, it's interesting. You mentioned that there were Dr. Ben Keyes. He used to be the director for Center of Trauma Studies, I think it was, at Regent University, and tells a story of sort of a therapeutic mission trip that they went on, and the family using a painting or picture of a deceased relative in sort of an empty chair sort of way. So it was kind of a blend of those two. So, yeah. Okay.
Yeah.
And on the other end of that, if somebody were interested in moving into art therapy, becoming a licensed art therapist, what would you recommend? What path should they take? What should they look for?
Yeah, sure. So I think it's a great field to pursue. It's certainly never boring. It's always interesting, and it can be very rewarding. It's challenging and can be difficult too. But the first thing that I would do is kind of figure out, where do you want to practice? Is there a particular state that you want to live in? Because as you know, different states require different licensure to practice. Some states do have licensure for art therapists. Many don't. And so if you're in a state, for example, like I'm in Florida, it's often easier to find a job with a mental health counseling degree and a mental health counseling license than it is if you're just new out of school and and you're trying to find an art therapy job, there's probably not going to be a lot advertised. There are far less opportunities in that regard. So figure out what state you're going to be going to so that you can determine what program of study would be best for you. If you want to do something that's solely focused on art therapy, or if you want to do something like I did, which is kind of taking the courses to become a counselor as well. I think the programs out in California might be more geared towards like marriage and family therapy, because I think that's the dominant credential there. And because depending upon where you want to practice, you don't want to invest all this money in grad school and then get somewhere and you're like, what? I need more school. I just spent so much money and time. So,
Yes.
figuring that out first, and then looking at what theory really fits you. All the different schools out there really have a different approach to the training, right? So if you went to the program at, say, NYU, their focus is very in a psychodynamic orientation into how they teach. If you went out west, there's programs out there that are more mindfulness, positive psychology oriented. I went to Lesley University in Cambridge, Massachusetts, and they are more integrative in that they teach all of the different expressive therapy modalities, and their program is called the Expressive Therapies Graduate Training Program there. So they give you some foundational coursework in drama therapy, music therapy, dance movement therapy, poetry therapy. And so they give you a more of an interdisciplinary approach with all the creative arts.
Okay.
So
cool.
So really like looking what really connects with who you are and how you would like to practice. That would be where I would start, looking at what state you want to be in, what is your, orientation and how you want to practice, and then look at the different programs to decide. You really need to have kind of a dual bachelor's in psychology and art in order to meet the prerequisite coursework for the graduate training programs.
Okay.
And then you get your master's degree, and after you graduate, then you start working on your credentialing. And then in order to do that, you need to find a credentialed supervisor, such as myself, to provide you with supervision as you complete your postgraduate training hours, just like any of the other counseling or social work or marriage and family therapy credentials. In art therapy is the same. You have to complete so many postgraduate face-to-face clinical hours with so many supervision hours with a credentialed art therapist to provide the supervision. I provide supervision for both LMHC and for art therapy.
And that was, again, you beat me to the punch. You're reading my mind. So yeah, you do both in the state of Florida?
I do. So I'm a qualified supervisor for LMHC in the state of Florida, and then I teach the course for other people who want to become supervisors. I'm going to be doing that next month. We have a course teaching other people how to become a qualified supervisor and all the good stuff that goes into making sure that you're doing a good job being a supervisor. And then I'm also a certified, an art therapy certified supervisor as well.
Awesome. Okay. So where do people find you? Yeah. How do they reach out?
Yeah, people can find me on my website, floridaarttherapyservices.com, or they can email me at Reina, Reina, at floridaarttherapyservices.com.
Awesome. Okay. And you mentioned it a little bit, but are there other projects that you're able to share that are in the works or coming down the road in the next year?
Yes. So obviously I'm going to be teaching the course, which we're looking at offering it twice next year. I teach it with a licensed clinical social worker named Amy Strom, who also works here with me at the practice. And then she's a clinical director at a grief support program in town too. And we teach the class together. So we'll be teaching that next month. It probably will have already happened by the time this is released.
Possibly.
But we'll be teaching it again in 2020. We haven't decided if we're going to offer it once or if we're going to offer it twice. We were talking about that option. And then on the side from that, I am creating an online resource for other creative arts therapists who are looking to go out into private practice. And so I'm going to be working on that, and I'll have a podcast to go along with that. And it's called The Creative Psychotherapist. And it hasn't started yet, but that is in the works and going to happen.
It's real now. It's on air. You said it. So
yeah.
No, that's awesome.
Yeah. So that's pretty exciting. I want to help other people to be able to do this work because it's hard to find a job in an agency setting as an art therapist or creative arts therapist. And so if you can get out in your community and do it on your own, I feel like there's so many more opportunities, and you can really create a fun and diverse way of working.
Sure. Yeah. Reina, thank you so much again for being willing to be on the show and share of your expertise. I know that you're doing just amazing work in the populations that you're serving, and it is so needed. There's so often that even in my practice here in Pennsylvania, where we comment on like, who can we refer this person to? Like, I think they need art therapy. I think they would really benefit from it. And yeah, like you were saying, it's unfortunately few and far between. So thank you.
Yeah, no, thank you for having me on and giving me the opportunity to share about it. That's exciting.
So yeah, I love to stay in touch with my guests and keep an eye on the different projects that they're working on. And I'd love to have you, back on for another episode or two at different points to just talk about, different aspects of art therapy and some of the projects that you're getting into. So thank you again.
Thank you. I would love to do that as well. And I'd love to have you talk about what you're doing once I get my podcast rolling.
It's a deal.
I think it would be really exciting to kind of have you share about what it was like to kind of launch a podcast to support your practice and to provide extra resources for the folks that you're serving. But, that goes beyond the 1-to-1 hour.
Sure. Well, we'll have to put something on the books, but take care. Have a good day.
Thank you.
Just to wrap up from this episode and let you all in on what's happening with the rest of season 1 and season 2. So we are hurtling towards the end of season 1, and that is still so mind-blowing for me to say. Just the idea that this project has gone this far, just the amazing guests that I've been privileged to have on the show in season 1. And the plan is to wrap things up for season 1 around Thanksgiving, end of November, beginning of December. And then I'm going to be taking a small break during the month of December just to enjoy the holidays, spend time with family and friends. And then we're going to crack into season 2 in 2020. And I'm so blown away by the lineup that we have prepared. So just to tease that a little bit, it's going to be starting off with an episode where I talk with Lori Gottlieb, who is a New York Times bestselling author, off of her recent book, Maybe You Should Talk to Someone, which, if you haven't checked it out, she's done just amazing national tour. I mean, she's been on, NPR, all the different networks talking about this book, which it's this amazing collection of stories from both sides of the couch of her life as a therapist and her life just in real life as a client going to therapy. So if you haven't checked out that book, I would highly recommend it. You can get it in any bookstore, Amazon. It comes in audiobook as well. But I'm really looking forward to bringing that episode as well as the rest of Season 2 to everyone. In OTC Episode 29, I'll be speaking with Dr. Matthew Carter about the science of sleep. If you liked what you heard, be sure to subscribe and review wherever you're catching this podcast at. You can check out detailed show notes and archived episodes at www.pfsonthecouch.com. If you want to stay up to date on future guests and contribute questions, be sure to follow us on your favorite social media platforms. The author and host of this podcast is not engaged in a therapeutic relationship with the listener and cannot give counseling advice without a confidential appointment. Listeners should be sure to consult with a licensed therapist in their area or seek emergency medical attention if they are experiencing psychological difficulty. A special thanks to the band The Topsy-Turvies for the show theme song. Their song, Like a Living Dead, can be found at topsyturvies.bandcamp.com. The bump interview track was the song 1973 by Bruno E. The author and host of this podcast is John Dennis. Special thanks to editor and show producer Trevor Groff.